Good morning. Yes. I'm Dr. Chantal. I am a pediatric dentist in Dr. Michael Children's Center.
Hello everyone, my name is Dr. Imnate. I'm a pediatric dentist at Dr. Michael's.
Hi, Dr. Nala here from Medcare Hospital. I'm the anesthetist who was involved in giving anesthesia for the dental patients seen by Michael and Chantal. Nice to have you on the show.
We are happy today to welcome Dr. Nala, the anesthesiologist of Medcare, who helps us all the time with our most scarce little children.
That's true.
Unfortunately, general anesthesia has a very questionable reputation, Dr. Nala. Every time we are in a situation where we want to propose general anesthesia as a treatment, we are facing a lot of questions from the parents, which are obviously out of genuine concerns. So we wanted you to answer these frequently asked questions or concerns by our patients.
Most welcome.
So I will start by the first one. Why, Dr. Nala, why GA has such a questionable reputation up to now?
Well, it's simple. If you're going to have a dental procedure and then you're going to say that you're going to do it under anesthesia, any parent is going to have a bit of apprehension. And the question is that most of the parents feel that why anesthesia at all for a dental procedure. And by the way, general anesthesia is a process where we need to induce a person to sleep and then wake them up after the sleep. So the parents are always a bit concerned. And what I would suggest is that things have changed a lot. We have a lot of technology, we have advancement in anesthesia. So I feel that the parents need to meet the dentist and then try to have a meeting with the anesthetist, and it will be easy for me to talk to them. And once I explain to them, then it becomes much easier. So it is a bit difficult initially to convince the parents, but once they sit with the anesthetist and they have a chat, and then it becomes much simpler.
According to you, I mean, of course, you have been in the field much more than we have been in the field.
25 years.
Wow. So 25 years is lifetime almost, yeah? My lifetime maybe. Okay.
You are very young, Dr.
Is GA safe according to you? Like when we propose this treatment, the first question that we ever come across is general anesthesia safe, doctor? So
100%.
Yeah.
Well, anesthesia is a state of where you take a person to sleep by medications. So what I normally tell everybody is that imagine yourself sleeping at 1 o'clock in the night, snoring and having a deep sleep, and then at 5 o'clock you wake up. So it's a similar state of where you induce the sleep and let the patient to have a comfortable sleep with medications. And these medications are reversible. They just work for a particular period of time, and they are all short acting. And once the effect goes off, the person is awake. Now during this period of sleeping, which is a state of anesthesia, you are completely monitored with gadgets which check your pulse, which checks your breathing, it takes care of your brain, it tells us what's happening in your brain, what's happening to your hemodynamics. So it's a monitored state of inducing a sleep and then getting them out of the sleep. It's simply just sitting in a flight where the cockpit it's just like a cockpit of a plane. You have the pilot sitting in front of all monitors, and you go just park yourself in the plane and just relax, and once the journey ends, you just get out of the plane. So this is what I tell my patients. It's something like having a flight journey, and in fact I tell them, if you want it to be an Emirates business class flight.
Business. And we would like to ask you a little bit more about what kind of medication do you use to induce this deep sleep with our young children?
Well, most of the time the anesthesia is called as balanced anesthesia, in the sense we use a cocktail of medications. One is to sedate, two is to induce a state of amnesia, that is, that you do not remember what happened to you. Three, we want the patient to be quiet, not to move. So we use medications which will make them not to move. It's a state of paralysis, but still that's induced with medications. And three, and number four, not to feel the pain. So you use a various 4 kinds of medications to take care of sedation, amnesia, immobilize the person, and not to feel the pain.
Yeah.
So that's called a balanced anesthesia. So once you give, and these are all medicines which are given intravenous. Sometimes we use midazolam for sedation, we use ketamine, we use propofol for inducing the amnesia, we give scopolamine to make the patient not to move, and of course we use narcotics like small doses of pethidine to not to feel the pain. All these doses are tailored to the weight of the child and to the requirement of the procedure. The same anesthesia is what we use even for big surgeries. What I would tell the parents to understand is there is no surgery here, it's just a dental procedure.
Right.
But the anesthesia has to be the same. So once you give the anesthesia, let the child to be quiet for you to do the procedure. So when you come out of the whole process, that is something different compared to what happens when you come out of a surgery. Imagine you're undergoing an appendicectomy. You'll give the same anesthesia, but when you come out of the surgery, then you have a lot of other associated things which makes you feel more different. Right. So in this, it is just like going to sleep in the night, 1 o'clock, get up at 5 o'clock and start brushing your teeth. So that's what it is like.
Right. This sounds simple, it sounds convincing.
Exactly.
Now, does the duration of anesthesia make any difference? Because most of the times we are asked, like, how long would you take when the question is addressed to us, and we say generally we book the operation or the dentist's room in Medcare for about 3 hours. But it depends upon how much work needs to be done, and the first response we might get is, "Oh, doctor, this is too long." So, what do you say about that?
Well, as I told you, the whole anesthesia is a balanced anesthesia with medications.
Mm-hmm.
Now, what we need to understand is when we start the anesthesia process, we give all the medicine that I told you in an injectable form, and then the child goes into anesthesia. Once you start the anesthesia, we have something, it's just like what I said again, it's like the flight journey. So you have a takeoff, then once you are in the midway, you maintain the anesthesia by inhalation gases. So we induce the anesthesia and maintain it with only gas. And this is inhaled by the child, and this inhalation is called as sevoflurane, which is very safe for children, and it maintains the state of anesthesia requirement till you finish a procedure. So if your procedure goes for 1 hour, so you continue to maintain the same inhalation technique till 1 hour, and then once you stop the inhalation gas, you come out, you wake up from anesthesia, and we stop and then reverse you out of anesthesia and take you to the recovery room. If you continue to have it for 2 hours, it's the same. The period does not make much of a change in the status of your body.
So basically we can say...
It's safe.
Yeah, it's safe. It does not matter how long we proceed with the treatment. The duration of anesthesia has no clinical significance.
Absolutely.
So, does the general anesthesia has an impact on the young brain and the ability of that brain to learn afterward? This is as well a very
common.
often question.
Once again, I give you the same dictum. It's a monitored anesthesia. What we need to understand is anesthetic medications are partly induced to give a state of what we require, and it is taken off from the body. Now what you need to understand is during the state of anesthesia, if the person is subjected to certain conditions like the saturation drops or the oxygenation did not go well, so that's what we call as associated with anesthesia. Anesthesia medicine does not cause anything to the brain, It's just that you take a sip of wine and the next day, the very morning, you're back again. So that's it. But if you don't have a monitored anesthesia and the anesthetist is not appropriately done his job, in between if you have a turbulence, and those dips are something that can affect the brain. So if you have, that's why at Medcare we've been doing this for 10 years now. And another very important thing is most of the anesthetists do this procedure in the operating room. We have made it simpler to take it to the dental chair in the dental clinic so that the dentist can be comfortable. And the monitoring is the same. So if the person is monitored throughout the anesthesia, it's one of the safest thing, and I feel it's got nothing to do with the medication has got nothing to do with your performance of your brain and things like that. Maybe they'll perform better with the sleep anesthesia.
If their teeth are fixed, they might sleep better for good.
Absolutely.
So they will perform better, that's for sure.
Sorry, same thing, but we need to know, because as I said that we are asking you all the questions that are most frequently asked to us. Once we are done with the anesthesia, is there any residual effect of the medicines? You already said it's reversible, so
Correct.
like how much duration are we looking at?
Well, it all depends again on the length of the procedure. So if it's going to be a 1 or 2 hour procedure, you just finish with the procedure. Well, the body, there are two ways how as I told you, the state of anesthesia is maintained by the inhalation of the anesthetic gas.
Right.
So the same way the gas has to come out of the body by exhalation. So over a period of time, you just breathe out the anesthetic gas, and then the whole body removes the anesthetic gas from the lung, through the lungs, and you get back to normal.
Does that also explain why the children would experience vomiting after
Well,
coming
because
out?
we induced anesthesia with bit of narcotics like pethidine, and we do a bit of sedation. So there are certain side effects which is compared to what benefit you're looking at, this is nothing. And these are side effects which last only for an hour or so. So that's why after we finish the procedure, we keep them in our recovery room for an hour or 2. So by 2 hours, the child wakes up. Then if it's got some nausea, we got to give a bit of anti-nausea medication, and we let them have some water and observe the child and send them home. So maybe for the first night, it might sleep a little bit when they go home, but it's only a matter of few hours. And sometime I heard the parents say the child was in the supermarket, in the McDonald's shop in the evening. So, each child, it depends how the metabolism works in the body, but it's completely reversed. It's completely out of the body, and there's nothing else.
So that you answered my question. The next question was how long does the child will be kept in the hospital after the procedure?
Couple of
you
hours.
said couple of hours. So you answered the question.
Dr. Nalla, when we do the procedure, we are doing IV, we are doing the nasal tube. Of course, nasal tube is essential, but could you just give us a little bit of your words on why are we using the tube in the nose along with the IV line?
Correct. Now, I clearly said that anesthesia is one aspect, and you asked me a question about what will happen to the brain and the function. So when you want to have a safe anesthesia, especially where the dentist has got to do a lot of procedure in the mouth, and we are looking at the airway. Airway is one place where it needs to be protected, and when you take a person from a conscious state to a state of unconsciousness or monitored unconsciousness, you've got to protect the airway.
Right.
So if you do not protect the airway, then you are going to land up in more problems. So one of the safest way to protect an airway is to pass a tube through the nose, because you're going to operate the mouth. Most of the time when we do anesthesia for adults, we pass a tube in the mouth and then send it down the breathing passage. Now, this tube helps in two ways. One, it gives you the space for the dentist to work on, and two, it allows me to deliver the anesthesia. I said the child has to continue to stay in a state of anesthesia by breathing the anesthetic gas. So that can be delivered safely only with a tube that can go into the lungs. And three, very important is, when you do any procedure in the mouth, you don't want the child to aspirate. any of the secretions or blood getting into the lungs. Those are the things which we do not want, and that is the things which can answer the simple question of the parents, will there be a problem, will there be a problem. So it's not the anesthesia, but if you do not do the steps correctly, that's where you can land up a problem.
So here we come with my question. What about the deep sedation versus general anesthesia? What do you think of deep sedation comparing to general anesthesia?
First and foremost, we talked about, should anesthesia be there for a dental procedure? Then the next question was, if you give anesthesia, is it safe? Now, anesthesia is a wide spectrum. It starts from mild, simple sedation till to a person who's undergoing the cardiac surgery where you give a depth of anesthesia. Now, in this spectrum, if you go in from sedation to losing your consciousness, now I clearly told you at any point of time, if the person aspirates because of the airway, and it's simply telling that a person who has a couple of drinks, and if he has 3 more drinks and he vomits, he's going to just aspirate. Right. Something similar to that. So when you're doing the procedure in your mouth, and then you're just induced a state of sedation, and if that sedation slips into a little deeper and more deeper, then the child can aspirate. And that can cause complications. So if you ask me, the safest way to do is, one, either you do it in your clinic with the person awake and you can take care, or send them to Medcare, I give the anesthesia and we do it completely safe.
With a tube.
It is always safer, yeah. And well, let me put it this way, if you have a child who can cooperate, and if it's just an extraction, it's criminal to say I'm going to give a general anesthesia. Right?
Okay.
But at the same time, if you have a child who got to do 3-4 root canals and crowns and fillings, and you're going to take an hour, I would suggest trying to just say, I'll sedate, I'll extend the sedation, Basically, we're trying to buy time by giving a little more sedation, and you can lose your control. And at any point of time when you lose control, you can be in trouble. So either in the simpler form, simple procedures where you just got to do a simple extraction of 1 or 2, and then a child is cooperative, you just do it under local as what you normally do, or just give a mild sedation which people do with inhalation. But once you come to a state of general anesthesia, and I need to do it only in one way, and that's the safe way.
So how we get it is that general anesthesia can be addressed as a very safe procedure because it is well monitored, and it's like, as you explained, it's like a flight where you trust the pilot. You will, once you have taken off, you will land. It's
Absolutely.
just the period in between, and that's where the anesthetist role come in, that you make sure that our entire journey is good.
And at Medcare, it's Emirates business class.
Thank you very much, Dr. Nalla. I think that answers all questions.
What I would also add on to that is, to make the process more easier, I've been doing this, again I'm telling you, this is something which you don't get in all the hospitals. Let's be upfront and frank. The simple reason being that it involves an anesthetist to be of that level to understand. And I started this whole process with my son being the first patient in doing it in the dental chair. I found that, and if the anesthesia is shifted to the dental clinic, it makes it more sensible because you got to do a long job and a good job. And most important is cost effective. If I have to do the same procedure inside an operating room, which is done in other setups, it's going to cost more. So Medcare is one of the few, Medcare is one of the few hospitals which offers general anesthesia in the dental clinic, in our own dental clinic, and that's where we have all of you there.
I think I may add there, I think it's not few of the hospitals. I think it is just one probably. I don't know the second one where they do here.
The only one.
So we can give that as a feather in the cap.
And I think it's good to do these sort of procedures if it is being under anesthesia in an hospital setup because you got a full backing.
Absolutely.
You have a support system where in case the child is going to have Maybe
anything,
nobody
yeah.
can, as I said, you can always have turbulence in a journey.
Yeah.
So
Right, yeah.
you are always safe in an hospital where we have all the other departmental facilities. We have a cardiologist, we have an internal medicine physician, we have an ENT doctor. So anytime you have some bleeding, which you cannot, and unanticipated problems
Absolutely.
can always be taken care much easily in an hospital setup, not in a clinic setup. That's why I said your sedation in the clinic can be just only simpler
Conscious sedation, which we do
Absolutely.
with the laughing gas.
to make.
Yeah.
Thank you very much,
Thank
Dr. Nada.
you
Thank
very
you for
My
your
much.
time.
pleasure,
Thank
and
you.
I'll be more happy to have all of you on board with more parents to take care of the children.
Thank you.